Hello, everyone. Hello. Happy coffee break return back. I think we'll have another one after this panel, so thanks for making it back in to join. My name is Liz Maxwell. I'm gonna let the panel we'll do a good chunk of self-intros as we kick off here, but just wanted to say a word of thank you to the Arch Group for having us and the Center for Global Policy Solutions. This has been an excellent event so far. I know we're kind of reaching the end of our conference life here as well too, so we'll try to focus in this panel on bringing some new ideas that haven't been talked about yet, with a focus on the business sector. We're going to talk about wealth building a little bit. We're going to learn a lot about the work of our excellent panelists and have some time for Q&A at the end too. So definitely be thinking of your questions, and we look forward to having a engaged conversation with you all, as no one has disappointed yet in this group. So get your questions ready and we'll be sure to get to you. So I would love to kick off with just meeting our panelists a little bit. I'll share a few words about my background and work, and I'd love to throw an intro question to each of us around, tell us a little bit about the work that you do and also how that relates to gender equity, how you've experienced that work to date. So again, my name is Liz. I work with the SOCAP and the MissionHub group. SOCAP is an impact investing conference based out in the Bay Area. It's quite a large conference. We gather about 3,000 people who do progressive funding and social finance, and a lot of cross-sector stakeholders in that. And I run a year-round event series gathering folks in Washington, D.C., in New York City, and in the Bay Area to continue that conversation throughout the year. And the main thing that I wanted to highlight about that as kind of an entry point and getting more into this discussion and to do a bit of knowledge sharing in the room is around the work that's being done in gender lens investing. There's a lot of progressive movement in that area, and the thinking about lobbying already and what we're sort of advocating for or not, but without mentioning specific funds, I'll just say that there's a lot of work by women investors and for women entrepreneurs. And I know we've already heard some of the statistics of how disparate the space is still, and there's certainly a long way to go, but just as a sort of shout out to anyone who's still in an active kind of professional development stage and looking for the next realm of work, there is a very large movement of women investors that are making big change in the space, and a lot of exciting women entrepreneurs that are getting projects funded internationally and domestically. And so I would just encourage everyone to take a look at some of the gender lens investing. There's lots of reports and movements online. So that's one thing that I wanted to highlight right off the bat. Jamillah, will you go next and tell us a little bit about the work that you do and how gender equity fits into that work?
Sure. Hi, everyone. So I'd just like to thank Arch for this opportunity to be here and representing my organization, City Health Works. You know, we've talked a lot about problems today, and I'm hoping that I'll have an opportunity to kind of discuss what are some of the things we're doing at City Health Works to be part of the solution around some of these issues. And over the past couple of days, I've met a lot of the conference attendees, and there are a lot of community health workers out there. Hi. And so, you know, City Health Works is an organization that's built on a community health worker workforce. And so this is something that we've been talking about is a really important part of the solution around creating this health equity. And so we are a nonprofit organization. We're based in Harlem, and we started about 4 years ago. Our founder, Mimi Kaur, had been working with successful community health worker programs abroad and brought that idea into Harlem, where she lived in East Harlem. And one of the things that motivated that was looking at the discrepancy in life expectancy for people living in East Harlem compared to their neighbors on the Upper East Side. So there was a 10-year age discrepancy there. And so she started this work to address some of those issues, partnering with community organizations, partnering with health organizations in the neighborhood, and trying to form a collaborative around what are some of the things and some of the issues that needed to be addressed in this area. And so the vision and mission of City Health Works is to create healthier, stronger neighborhoods. And we do that by hiring people who live in the neighborhood in which we serve. And so our goal is to help to develop neighborhood capacity, neighborhood resilience, by having people work with their own neighbors around some of their health issues. We partner with health clinics, and we hire health coaches who are community health workers who have no more, they are not required to have more than a minimum of a GED. And these workers are offered a full-time job, salary, health benefits. Some of the things that we've talked about are important for wealth building, around making sure people have access to paid maternity leave, paid sick leave, paid vacation leave, have access to flexible spending accounts and things of that nature. We also make sure that all of the training that is done for this job opportunity is paid on-the-job training. And so people have an opportunity to learn and make money and be able to grow in their own professional development over time. We also partner with the existing services that are in the neighborhoods that we're serving. So partnering with existing job readiness, job training, local employment agencies to make sure that we can identify the best candidates for this work, and so that we are already working with the existing collaboration and networks that are in these neighborhoods, and building upon that work that's being done. I think, I'll end there. There are a lot more things I want to talk about around workforce development and that nature, but I'm sure we'll have a chance to get there. Thank you.
Great, thanks, Jamillah. Yeah, I definitely want to get there. And I just want to highlight that Jamillah and City HealthWorks is such an amazing example, I think, of what the focus of this panel really is, which is ways that businesses, for-profit, nonprofit, but business models can work and treat their employees well and have a big impact on communities. We're seeing lots of examples of that in the social enterprise sector, in the nonprofit world, and there's these diverse funding and business mechanisms that I think of it as just the growing social consciousness movement across all sectors, and it is just sort of obvious, I think, to all of us on this panel, all of us in this room, that it's not mutually exclusive to do that work, and I think that that's what we need to keep highlighting as we push the word out to more and more folks. So, David, Levine, I'd love you to say some words about what you do, and yeah, kick us off.
Great. Good afternoon. So, real pleasure to be here, and to have this conversation, because for us at the American Sustainable Business Council, it is the very question of what kind of economy and society are we actually building. What are our real goals? When we look at the problems that have been addressed here, how are we working to solve them, and what is the ultimate goal here? And so part of what we came to back in 2008, 2009, when we formed the American Sustainable Business Council, is that there had been this sort of monolithic voice that defined what business thought, right? What policies we should have that are in the best interest of business and the economy. And that is most vibrantly represented by the U.S. Chamber of Commerce, the National Federation of Independent Businesses, the National Association of Manufacturers, but all operating with short-term profit at all cost. At all cost. So the health inequities, the economic inequities, just the way society is built, just works just fine if you're driving on profit at all cost. And what we did was we looked around and understood that there had been an incredible growth of, call it, values-based businesses, businesses that understood that there was more to business and more to life and more in terms of the roles and responsibility of business in the economy than just that short-term profit, that there are social, just economic, environmental factors, right? So that what sometimes is called the triple bottom line, or a blended value, or a sustainable business, or just common sense business that says that we're here to take care of our employees as well. That's good business. We're here to take care of the environment in which we live. Why? Well, you see, disease, bad health, bad for business, right? So the whole idea was to build a business organization that can come in with a vision, a set of strategies, but also as a political force to engage in policy and decision-making in this country to act as a counterbalance to the U.S. Chamber. So we built the American Sustainable Business Council as a council of business organizations and individual companies so that together we could advocate and be the voice and power for values-based, responsible, just, what we call sustainable business. So now collectively, with all the kinds of individual businesses and the business organizations, from Alabama to Georgia to North Carolina to Ohio to New York to California to Montana, across the country, across all sectors, across size of business, particularly though the micro enterprise, the small and the medium businesses who have had little voice in the discussions in this country. Collectively, we are now representing over 250,000 companies. So we can go toe-to-toe with the U.S. Chamber. We don't have their hundreds of millions of dollars that they use in advocacy and lobbying and paying off politicians, but we have the voice of business leaders that are stepping forward at the local, state, and national level to advocate for the kinds of policies that will address the kinds of issues, but also the solutions that we need, which is about how do we reclaim the economy that should be in the collective hands of the people of this country.
Thank you, David. Excellent. We're going to come back to you in a second and frame a little bit more of that historical context of how we got here, and then we're going to spend most of the time on solutions today. But Teo, I'd love you to share a few words first about Restaurant Opportunity Center United, please.
Sure, and thanks everyone for having ROC United represented here. Our mission is to improve wages and working conditions for restaurant workers around the country. There's about 12 million restaurant workers right now in one of the fastest growing occupations, but also one of the lowest paying occupations. We represent about 25,000 workers and about 200 employers and several thousand consumer members as well. And we've been working with high road employers who actively work with us to raise wages and improve provide benefits and look at how to improve the working lives of the people who give their labor to nourish all of us when we do go out to eat. And so we've had about 200 business owners that have come together in Reyes. It's called Restaurants Advancing Industry Standards and Employment. And Reyes is also a member of ASBC, so it's nice to be up here also sharing. We've also recently formed a network of restaurants called Sanctuary Restaurants who are interested in building a safe space for everyone, essentially, together under the banner of a place at the table for everyone, a place where you can come without fear of discrimination, without fear of being attacked for your ethnicity, nationality, place of birth, etc. And so we found that there's actually, there are hundreds of businesses around the country that support our values and who are interested in working to advance these common goals with us. So that's what we've been doing. I do have my background. I do have a PhD in behavioral biology, actually in the Department of Human Development. And so I'm very interested in how the environment shapes the body and how the body also shapes the environment. So this issue of health equity is something that is very important to us. We do a lot of research with our members. We do participatory research where we have members go out and survey other workers. We've gathered surveys of over 5,000 workers this way, and we've conducted hundreds of interviews with employers and workers to show, that the business, this high road model that we support is possible and can be adopted throughout the nation. We have recently begun to measure mental health as well. I would love to get us to measure additional health indicators, but we're slowly working through the logistics of that.
Amazing. Thanks, Teo. And Teo, I'm curious, just off the bat, are there particular focus on women restaurant workers and any analysis of that feels relevant to share and kind of framing our discussion?
Absolutely. So actually a majority of workers in the restaurant industry are women. 54% of all workers are women. And when you look at tipped workers, which is right now our primary focus, is looking at one fair wage, or how is it that we eliminate the sub-minimum wage for tipped workers, which I don't know if, I assume some of you know, probably not everyone, the wage for tipped workers across the nation is $2.13 an hour. So that means if you work for tips, by law, you can only be paid $2. You can be paid just $2.13 an hour, and 70% of those workers that work for tips are women. So we're in a situation where, we have a gender pay gap, and then we have an industry that is primarily women, where by law they can be paid, a fraction of the minimum wage as well. So that's very important.
Yeah, that's where we stand. That's incredible. Wow, thanks for sharing. So as we dive into more of a discussion here, David, I was actually going to come back to you first, and you touched on some of this in your opening remarks, but I was wondering if you could share a bit more about the historical context as you've seen sustainable business evolve over the last few decades, and particularly for women, what that's looked like, equity in the workplace, as they're seen in leadership positions, in the pay gap, as we've seen. I know that we've had some progress over that in the last few decades, and I kind of want to ground us in the present by looking back a bit, if you've got thoughts to share, and if anyone else wants to chime in as well, and we'll sort of move forward from there.
Well, I think in part it's actually the progress that has not been made that has driven, whether it's a socially responsible, the sustainable, the different set of business opportunities and strains that you see, right? You take a lot of the Main Street businesses, right? Main Street used to be, the stalwart of the American economy, right? And how many Main Streets have we seen destroyed by the big box stores that have come in and undermined communities overall?
Did you say big box stores?
Huh?
Big box stores.
Big box stores, yes. So the large chains, the Walmarts and the like, that have driven down the wages, that have not provided the benefits, that have showed up in communities, and there go the mom and pop shops that were a staple of a lot of communities. So you've seen the emergence of Main Street businesses or localism, right? I want to know who I'm buying from. I want to know where my food comes from, right? I want to know and have that relationship with the business that I'm doing business with. Hey, I'm spending the money. We've heard the numbers earlier, right, about the amount of the economy that women control, right, in their spending, right? As an organizing opportunity, that has actually had tremendous impact on changing a lot of the way that businesses have done businesses, right? Take an example, right, of toxic chemicals. We talk about the impact of health. Toxic chemicals, when children are born with over 200 chemicals in their umbilical cord already, there's something seriously wrong in this country, and we could source that to the lack of caring on the part of businesses. So what has emerged then is businesses that have stepped up and said, no, we can provide product that's free of hazardous chemicals. And by the way, that's actually good for business, because what mother, father, brother, sister is going to walk into a store and say, no, I'll take the most toxic one, the one that'll poison my child today? Yeah? Who's going to want to do that? But yet those businesses can continue to operate. And so what we've needed to do is see the emergences of the seventh generation, the Honest, the earth-friendly products, the others that are, right, our friends at WEAC now are looking at the products that are being used in the African-American community, the cosmetics, filled with lead, filled with mercury, filled with all these other toxic chemicals. No problem in moving those chemicals into those communities. So the emergence of companies that understood that there was a social responsibility that they had to society, at the same time understood that there's a market for it, right? That there's a need for that. And we've seen the campaigns that have overnight transformed and have looked at specific chemicals or products and gotten them out of the marketplace, because particularly women have mobilized around those products. But we still see those as pervasive problems, right? So you see the problems with dollar stores, right? Dollar stores being one of the most common places that people in low-income communities and communities of color have access to product, to food, all laden with the wrong sorts of ingredients. Don't even know what's in them because there's no ingredient transparency in this country. Other policies that we're working on. So there's a whole emergence of projects and programs that are about how do we get local entrepreneurs to provide the safer, healthier products. So you take Albuquerque, New Mexico, where there's an agricultural cooperative of urban farmers that are now providing local, healthy food to the school system, to others around them as a means. That's the emergence of other sets of businesses. You have the social enterprise movement that's grown up where they're explicitly setting up as a part of their mission to actually say social conditions are a part of it. You have benefit corporations that are now legal entities that are building in the social and environmental and the stakeholders, not just the shareholders, as a part of their mission. Right? So these come in many different forms, but what's key here, and the reason we started was with ASBC, the council, was that what was missing was there's a lot of great work that's being done internally in companies, but we weren't coming together to have this larger voice and power so we can change and get to work at the systems level to change the rules so that we can make this the norm as opposed to the outlier.
Yeah, and I think a lot of what you're touching on here and many other speakers today have mentioned too, a big focus of this event is the intersectionality of it. And I think that the point about toxicity really raises, in the investment community, people are saying that environmental impacts of businesses and very large corporations, it's actually part of the fiduciary responsibility of investors and boards to consider. It's not doesn't become an additional bonus, optional metric that we can look at, but climate change will affect every business, right? And we have to take the environment into account. And when we look at health causes too, that's what we've seen is the intersectionality there, that the toxicity in the environment is something that we need business to take responsibility for, we need government to take action on.
That's right, and just
we can't afford to wait.
To turn it back to almost to Teo in part as well, but this whole frame also around high road business that we work on, so that's, you know, raising business leaders speaking up in favor of raising the minimum wage, of paid leave, of sick leave, of ban the box, of fair chance hiring, right? You know, all of these are part of the movement that in particular that we work together on and saying, you know, this is good for business, it makes good business sense, it makes good economic sense, this is the way the economy should run. So, I mean, this is important that, you know, the kind of work that Teo, you're doing with the restaurants as well. I don't know if you want to.
Yeah, Teo, did you have something to ask? I saw you hold up the mic for a second.
No, well, I mean, so we focus a lot of our advocacy is heavily research-based, and we have conducted surveys with thousands of employers as well. And what we found is the employers that provide provide higher wages, provide benefits, we can demonstrate that they actually have much reduced turnover, and so that there's this incentive essentially, because especially in the industry which has a tremendous amount of turnover, it's almost 100% turnover per year, we can demonstrate that there's a real simple way to solve that, and then that you don't have to be constantly retraining new staff. And so, you know, there are clear benefits to it. But also, you know, we've looked a lot at differences in regional differences. So, for example, there's 7 states that do not have a sub-minimum wage. We call them one fair wage states. And there we find actually the industry as a whole is doing better than in the rest of the country where you have a sub-minimum wage for tipped workers. So this idea that, you know, raising wages is somehow going to automatically create a negative business climate is just not true. And that's something that we work hard to demonstrate, and this is a way also to recruit employers to the cause.
Yeah, excellent, thank you. Okay, so I want to talk a little bit about workers and ownership in businesses as well, but also in the workforce development area that I know Jamillah has a lot of experience in, and City HealthWorks is doing some amazing things, particularly with their women workers. So Jamillah, will you share a little bit more about that program?
Sure. So You know, I forgot to mention earlier that, you know, we know that the community health worker workforce is primarily women. And one of the things that happens in occupations that are primarily female is that the salaries tend to be lower. And so one of the things that we're doing to try to combat that is to make sure that we are paying well above the minimum wage, that we're trying to pay a living wage so that our employees are able to sustain themselves successfully living in New York City on a living wage. And one of the things that we do as well in our identification and hiring process as we're working with, partnering with neighborhood organizations around job training and readiness, is to place value on the work that women are doing in their regular lives. So, you know, when someone comes to us, we're not just asking about, you know, what's on their resume and what education they've had, but we're looking at what is your lived experience? Have you been a caregiver? Have you helped your grandmother with her diabetes? Were you someone who worked as a community advocate? What other sorts of lived experiences do you have that would make it more likely that you would be able to do well in this work? What sort of empathetic work have you done? How have you demonstrated listening skills? How have you demonstrated that you're a compassionate, caring person? And we bring all of those things into the interview and hiring process so that we can identify the best workers, but not on the kind of stringent academic criteria that is normally used for the sort of for job placement, but looking at more of, you know, what is sometimes deemed soft skills. Or we know these are hard skills, actually, right? These are not things you can teach someone. I can't teach someone to be empathetic. I can't teach someone to be compassionate or how to be a caring person. These have to be intrinsic skills. And so really valuing some of this work that people are doing in their real lives. Another thing I wanted to talk about was the importance of flexible work schedules. For people, for women in particular, to be able to work and be able to have a family and be able to serve as a caregiver or a volunteer or whatever it may be that women want to do to have a full life. We need, as businesses, to be working on policies that allow people to have flexible options, to be able to work from home when necessary, to be able to have part-time work options. I want to actually read something about one of our workers. Her name is Hilda, and she went out on maternity leave, and she was very afraid to ask for an extended leave. She wanted to have a little bit more time to stay home with her son and bond with him and establish breastfeeding, and she just didn't know how that was going to work. And so Hilda, shared with me something that I wanted to read. So she says, first, I want to say that I'm very thankful for the flexibility and support that I received during my pregnancy. I have friends who had to quit their jobs after having a child because of lack of flexibility with their jobs. Being a first-time mom, I didn't know what to expect. I thought I was going to be able to easily go back to work at 12 weeks. I quickly realized that I was going to need more time to bond with my son and get breastfeeding well established. Breastfeeding and pumping and storing milk was hard. I knew I need to do this well, so I was going to have to extend my leave. When I came to the office to have that conversation with Danya's our previous director of operations, I was honestly prepared for the worst case scenario, that I would need to quit my job. However, everyone was very understanding with me, allowed me to extend my leave, and created a timeline to slowly ease me back to full-time work. I was allowed to work from home, I was able to work part-time, and my caseload was slowly increased over time to ease me back into part-time and full-time work. I was also fortunate to work in the neighborhood that I lived and where my sitter was, so that I could go and breastfeed my son on my lunch hour and still carry on with my work day. I think having a CEO and other female leaders at City Health Works who are mothers was an advantage because you were able to empathize with me and were willing to work with me. As a result, I was able to breastfeed and become a full-time working mother. I'm grateful for that experience because it's been a blessing. And so I shared that story because there's so many things, kind of wrapped in there, right? This idea that, when you have a baby, now you have to quit your job. You might not be able to have the workplace policies in place that would allow you to be able to successfully breastfeed and carry on with other things in your life. And so, our CEO, when she went on maternity leave, she took a real maternity leave. We didn't hear from her for weeks. But she modeled for us how important it was to take that time to be with family, to care for yourself, and to care for those who you loved. And so that model has been something that we've tried to share with the workers there and be able to increase. I think that as we, talk through all of these different policies, whether it's restaurant workers or whatever, all of these sort of workers who are, at some of the lowest wages, they need opportunities for flexible employment. They need opportunities to be able to live full and healthy lives by workplace policies that make that possible. So I just wanted to share that.
Thanks, Jamillah. Yeah. I want to stay on workers for a little bit, and David or Teo, maybe you have some thoughts here, but I'm really interested in also getting at, I know there's a lot of employee ownership programs and ESOPs and cooperatives, and
right.
David.
So I think that's the other opportunity, right? So if we look at the way the economy seems to be focused, it's how to get more rights for workers working for corporations that are not aligned with the values that we have. And so an alternative, a growing alternative now, is really worker ownership as a means to secure control. And it's not a totally new model that's out there, but it's one that's getting some more and more resonance as we see income inequality and all the other inequalities continue to raise. The idea of reclaiming and owning the economy for oneself and having that kind of workplace democracy and ownership is a model and a key opportunity. So you could take, a number of different projects, like one of the oldest one is Cooperative Home Care Associates that's in the Bronx. $60 million business, 2,000 plus worker owners, mostly women of color, yeah? Cooperative Home Care Associates in the Bronx, decades old now, surviving and growing. You have Si Se Puede, which is home cleaning. Again, mostly Latino women in New York. You have Wages in Oakland. It's a similar project of worker owners, all women that are driving the decisions for these enterprises. So there's a growing number of opportunities to look at these models of saying, what kind of enterprises do we need to serve the needs of our community? And then how do we ensure that we are no longer just employees looking for others to give us the benefits, but we can self-determine the direction and the opportunities that we have for us. And there's large-scale work that's being done. I mean, in Spain, they have one that's 65,000 workers. Mondragon is a great model that a lot of folks look to. Multiple businesses across many different sectors. And as a part of this, part of the leverage of connecting this to the community organizing work that some of you are doing is the idea of what they call anchor institutions. Getting the hospitals, getting the universities, the schools, the government to actually do, just and sustainable procurement, to actually purchase from the kinds of businesses. So whether it's worker-owned co-ops, or it's your local-owned businesses, or it's the responsible businesses, looking to procurement as a way of sort of ramping up the opportunity to move the dollars back into the places where you want, thus creating greater well-being across the board, right? So that's another model within that frame. And there's a few others as well.
Well, and I just wanted to chime in addition to the well-being, I think it's just one of the fundamental pillars of wealth building. And when we really talk about wealth as an anchor in a foundational element in health and long-term health in communities, that's what I'm hoping we can talk about a bit at the end of this, but just fundamentally, what are those wealth building strategies and other financing mechanisms as well of community development banks, along with this worker ownership piece that really, and local economies that keeps money circulating in communities, isn't extractive-based finance that continues to pull money out top into the 1% and into the sort of abstract capital markets there, but keeps money for the people who own it, who are doing the work inside of it, and is connected to the real economy. Teo, do you have anything to add about, I'm curious if there's examples of worker cooperatives in the restaurant space, and I also want you to talk some about policy solutions. And sorry, yeah, David, I think you're chiming in too. Yeah.
I mean, there certainly are worker cooperatives. We do partner with some of them. There's one in Austin and in Grand Rapids, Michigan. We have a couple of restaurants that we have also, that we have in New York and in Detroit, and one that's about to open in Oakland, California as well. Although those are primarily a space for workforce development, for training workers to work in fine dining establishments. We see a really big, there's a huge color and gender line in the restaurant industry. Many of you, if you maybe have already noticed it, and if you haven't, the next time you go out to eat, you should pay attention as to, the composition of the staff, the demographics of the staff from the back of the house to the front of the house. And we see that in general, basically as you move to the back of the house, people get darker, and it's really across the board based on whatever the local demographics of the area is. So if you have more of a Latino population, it's going to be Latinos working in the back of the house. Maybe in certain areas it'll be, Haitians or whatever the local demographics are. And then if it's fine dining, we have this this gender line that occurs between what you can consider casual full service, like your Olive Garden, Denny's, and those types of restaurants, versus fine dining. As you move from those into the more fine dining, then it's mostly, you go from women to men who are serving you in the front of the house. And the places where you're really able to obtain wealth are, it's going to be these white males working in these fine dining positions as servers and bartenders. So that's one of the things that we've been working on as well. We've developed this racial equity project with several of our partners, starting with partners in the Bay Area that we're trying to expand nationwide, to have, first of all, we have employers take implicit bias tests to try to, position themselves within, broad understanding, even though they have progressive values, understand that there might be some barriers that they have in their hiring practices. And then we work through multiple steps that they can take to improve, to really diversify their workforce and create opportunities. We're really, one of our areas of interest is developing career ladders, so someone can come in and start as a dishwasher and then end up being a fine dining bartender or waiter, as a way to build wealth and ensure that that's both, that's breaking both that gender line and the color line as well.
Yeah, excellent. Okay, so we've got a few minutes left here on stage before we break into Q&A, and I would really love to hear lots of questions from the audience. We'll try to save as much time for that as possible. Before we go to Q&A, I want to talk about policy a little bit more. Policy is very much not my background or wheelhouse, but each of our panelists have much more experience in it than I do, and so I'd love to hear a little bit of here's an idea for a frame or a challenge. One policy solution that has been a win. Like, I would just love to know a little bit more of what has been very successful in creating stable families, has made a real difference in within your sort of sector or purview, and then what's on the table now that you're really excited about, something that you're advocating for, and not that we're inviting anyone to call anyone specifically about it, but just, what's hot in policy right now that could make a big impact in terms of how business intersects with policy.
Yeah, I mean, just briefly, one of the things, there hasn't been a lot of talk about maternity leave and breastfeeding leave, so these are things that I've been talking about, but there is a toolkit called the Business Case for Breastfeeding, and that's a wonderful resource for organizations to use to help promote breastfeeding-friendly, family-friendly workplace policies, and so that's a good place to start. There's also some legislation around compensating community health workers for the health-based work that they're doing, to include them as part of the value-based payment system redesign that's happening right now. And so those are some of the policies that I would highlight as being important to this conversation around health and gender equity.
And
it's called the Business Case for Breastfeeding. The Business Case for Breastfeeding. Yeah.
And Jamillah, not to put you on the spot, but do you know the current state of breastfeeding in the workplace? Like, how is it? Just, it seems very rare to me, is my understanding, that there's,
I don't
accessibility
know
for
all of the numbers. I did hear earlier that 12% of businesses have maternity leave policies. So I'm going to imagine that it's going to be some number around that or lower with well-developed breastfeeding policies in place. And so these are things that are not easy to correct, but if you take the time and energy to do so, they can be corrected. Basically, all of a breastfeeding mother needs is time, a space, and some privacy in order to be able to pump successfully. And in the example that I gave earlier with the field-based worker, she was able to, because she was working in the neighborhood that she lived, was able actually to go on her lunch break and be able to nurse her son and be able to carry on with the rest of her day. And so, you know, these are important things to keep in mind when we're trying to think about family-friendly, female-friendly policies in the workplace.
Yeah, excellent, thanks. David, did you have thoughts?
Well, I'd say you could divide it up into a number of categories in part. You know, so there is, unfortunately, we have to establish the base minimum. And now more than ever, with all the dismantling that's taken place at the federal level. So, you know, what we did see, even in the last election, we did see a number of bills pass around minimum wage. We saw a paid leave policy being pushed. So, you know, these efforts, you know, need to continue because, you move it in enough localities and in enough states, it looks like a national policy that we can keep driving on. So the politics of moving on, at least establishing the core base of the kinds of benefits that workers should have, the basic rights that they should have, the basic level of a livable wage that they should have, these are key and crucial policies. The work, $2.13, right? You know, what is it? The U.S. is one of 3 countries in the world without paid leave policy. In the world, you know, not acceptable. But then on the flip side is, you know, how do we incentivize, though, these high road workplace practices? You know, Rock has a guide of restaurants and the things that you could look for. We have a number of business case materials on our website that make the business and economic case that you all should be free to take and use to make the arguments that you need, using and throwing back in their face the business and economic case. That's why we built this. But we're coming out with a report soon on incentivizing high road workplace. What are the policies? What are the practices? Procurement, I mentioned, is a tool, but moving the money that we talked about is another. So new tools that have come up recently are things like crowdfunding platforms. So, but whether you use the technology of crowdfunding platforms or you look at community wealth building in the form of neighbors getting together with neighbors, pooling money, and there's a variety of different forms, right, that you could pool money to then invest in this case, in the women, in the new entrepreneurs that you want to see prosper, and then they could start to offer that back in. And what we've seen from projects like the Grameen Bank and other projects like Kiva and other projects here in the United States is there's a higher payback than the regular loans that banks are making. Let's stop looking for the banks to do the right thing alone, and let's start collectively, you know, moving the money to the things that are important. So community development credit unions, socially responsible banks, you know, crowdfunding, community supported slow capital, right? All these are, and a variety of other mechanisms that I'm happy to share with others, are actually working models of how you can move the money back into the things that are important. And let's stop asking for folks to do the right thing for us, and let's take the ownership. That's the key, and moving the money is part of it.
You reminded me of one other statistic that I haven't heard come up at the conference yet, and so I just wanted to share. There's some research by the Pew Center, I think a year or two ago, that on average, white families in the U.S. have $144,000 in assets, so that includes home ownership and savings and 401ks and pension funds. And so that's 144,000 for white families, and for black families, does anyone want to take a guess? I'm hearing whisperings. I don't. The number is 11,000. 11,000 for black families. I believe it's 13,000 for Hispanic families and 144,000 for white families. So a lot of the tools that David was just mentioning and that we've talked about on this panel, I think, are really about that, and including the worker ownership and the family leave and the breastfeeding ability within the workplace. All of this has a real impact, right, on how families are able to build and accumulate wealth over time, and be thinking those kind of long-term strategies. And a panel earlier today was mentioning how that wealth gets inherited down the line. And obviously there's a lot of structural racism and inequity to dismantle to help that along the way. We need to go to Q&A, but Teo, just last question of policy solutions. I just wanted to make sure that you had a chance to highlight.
Very quick thoughts. I mentioned one fair wage legislation, which ensures that there's a base wage for everyone that isn't based on, a tip penalty. We've found that workers in these 213 states are twice as likely to experience sexual harassment as workers in the one fair wage states, because they, if you depend on your tips to pay your bills, first of all, the manager or the owner encourages you to put up with any type of behavior because they don't want to have to make up the wage that you're getting. And some people who are, if someone's leaving you a big tip, you're much more likely to put up with behavior that's inappropriate as well. So we found pretty extreme cases of sexual harassment throughout these sub-minimum wage states. So that's something that gets impacted. And we also found that anxiety and depression went along with that. So workers in 213 states, again, had twice the rate of anxiety and depression. So that impacts, your life at work and at home. Another policy initiative that's important is fair scheduling. If you have children and your schedule, your schedule changes, or you're all of a sudden kept after, all of a sudden you're told you can't leave when your schedule ends, when your shift ends and you have to stay, and you have to pick up a child from childcare. If you don't pick up your child a couple times, it's possible that they'll call Child Protective Services. It's just a huge amount of stress, and this chronic stress has a terrible impact on the body. There's a lot of fine dining restaurants that are pushing this idea of tipless or hospitality included. And what we found is that in those places, which have to pay much higher wages, they pay between $20 and $40 an hour. Workers don't have to fight over the best shifts because they don't depend on those tips, and that means that they have a much higher quality of life at home and have a better quality of life with their children.
Okay, let's open it up. Questions, comments, thoughts? We love to be in dialogue with you. What did we miss? What else should we all be thinking and talking about today?
Hi, my name, I'm right here. Oh, wow. My name is Dominique Jones, and I'm from the North Carolina Community Health Center Association. And my question is primarily for all the panelists. Thank you for a great talk, but Jamillah and David around community health workers and the triple bottom line. And so, of course, the hype of community health workers is stirring back up again due to the Affordable Care Act and potential restructuring. But I'm curious from the perspective, someone shared with me that the triple bottom line is somewhat of a new phenomenon. Not really new, but or let me preface it this way. When you talk about community health workers, the emphasis of return of investment models, ROIs, and really getting employers and organizations to understand that the money is not necessarily like you don't get a deposit for a community health worker as far as like a check or a credit, but that a return of investment is kind of that the money doesn't, it's like the stock market. It doesn't really move, but it grows. Are you able to speak towards like any trainings or your thoughts of really getting folks who want to engage in community health worker sustainability, but don't really know how to transition out of soft money to a sustainable model?
Thanks, Dominique. Yeah, so sort of question of measuring social impact, it seems, from the
I'll take it from
investor side
the
in
meta level,
community health.
and maybe you can do it from the specific. Part of the problem that we've got is, what we measure, right? In measuring the GDP, you take the great example of, someone buys a pack of cigarettes, the GDP goes up. They have to start seeing the doctor, as their health goes down, the GDP goes up. They die of lung cancer, the burial has costs, the GDP went up. Quality of life for that person, their family, the community has not gone up. If anything, it's gone down. We talked about obesity, we talked about these impacts, are not measured. The caregiving that we talk about is not measured. The value of that is not that we have to put a dollar value on everything that we do, but this idea of alternative indicators, like the gross progress indicator is one. The UN has a set of indicators that it's using now as well to start measuring well-being. Bhutan had the gross happiness index to measure well-being, not just dollar flow when we have negative impacts taking place, when we have greater inequality, when 1% now has greater wealth than 99%, that the numbers have climbed, and the GDP goes up. So we're not measuring the right things, and certainly the value of community health workers is not being measured appropriately and therefore not being compensated correctly. The value of teachers not compensated correctly. The value of all sorts of other workers not valued in the way we measure things. So we need to turn those systems around at the meta level as we then create the sort of the working systems at the community level. And so then I turn it back to you, yeah.
Yeah, I totally agree with that. And I think, we do have to shift our focus on looking at the skills that, working class women bring to the table, who are often our community health workers, and valuing and respecting that work and those skills, and making sure that that population is paid well. And so some of the work that we've done, we are really focused on gathering data and looking at outcomes and being able to prove the return on investment in working with community health workers and the impacts that they can have on the community. Some of our preliminary data shows that we have a $600 per member per month drop in healthcare spending after members are working with community health workers in our program, health coaches in our program. And so that's preliminary data, and we're hoping to have a lot more over time. But this is one of the ways that you can prove that these programs work, that they're successful, that patients are getting better, that costs go down. And so it makes sense to put that money into those programs up front and to pay people well. We really have focused on making sure that people are getting an affordable wage. I've worked with other programs, community health worker programs, where people get a stipend or they get a Metro card or not a proper salary. And community health workers are doing valuable, hard, emotional, draining work. And so they deserve to be compensated fairly for that work. And so that's something that we really think is very important, and we're trying to prove the ROI on that as well.
I'd also make one last comment to your question of making the case to funders that the foundation and philanthropy space for a long time, I think, has a better system for measuring impact in that way. And social services, also government, has been trying to measure the social impact of this work for a long time. And that's what the impact investing space is really pulling from mostly as they start to make the case to more and more business and for-profit-minded investors. But honestly, it's just a big education game, we think, at the moment for investors and for funders that are used to only seeing one kind of bottom line to helping them see these other outputs that are inevitable, and so we kind of say either the outcomes are positive or negative socially, environmentally, but everyone's having some impact, and so it's our responsibility to make sure they're as positive or as non-negative as possible. Yeah, let's get more questions here. Great question. The first question, yeah, please repeat.
Okay, I'm sorry. For the restaurant workers who are on the tip payment, I mean, is there something like a little something on the door that lets you know how those employees are getting paid? Obviously, I don't do high-end restaurants very often, so the lower-end ones, I'm now concerned if I'm leaving a sufficient tip.
Yeah, there isn't, but we are, we're actively working to create consumer demand. You have consumer demand for organic food and for farm to table, but not for livable wages. And so that's something we're trying to do. We're working to create a system where customers can leave cards for management or for the staff to encourage that.
Good, thank you. And my second question is on the issues of, buying local and, small business and organically grown cosmetics, whatever. The cost is just usually very prohibitive. And even in a middle-class environment, sometimes you can't afford it. You want to, but, you say organic, 20 cents more a pound versus not. So, again, the cost prohibitive for low-income families is even greater. I mean, it's a big decision.
But you've seen, actually, not that I'm asking folks after I railed against slightly big box stores, but you've seen them selling the organic products. You see them selling local. Walmart is now the largest purchaser and seller of organic foods. Walmart is the largest. So the point being, it's showing up. The price, for some of the companies that early on, like a seventh generation whose products were out of the price range, they found a way, as demand grew, to lower the prices as well. So it was no longer a niche market for the well-to-do. And as more and more community businesses arise, the ability because let's understand, though, true costs, though, right? And that's the thing that we're not measuring, right? The reason why there's cheaper products is because, why? Because someone's paying someone less. Someone has no regulations in which they're ensuring that there are safe and healthy working conditions for the workers to be taken care of. So choosing to not purchase those products or to regulate that in a way to ensure that they're paying the true cost, right? So businesses, right, are paying, what it really costs to do. So they dump the pollution in the community. Why does the community have to suffer the health consequences, the health costs? The community, the government has to pick up the costs of that, the emergency room visits, all of that, right, gets passed along. That's why we need to hold them accountable. That will drive what we would call a fair and level playing field then, when we measure the true cost of doing business and we start moving our money to businesses that are taking on that responsibility now as well. And the more that we can invest in those, the more that they can provide the products at the scale that we need, right? So combining all those factors will make a big difference at the end of the day in changing the way, because at the end of the day, those cheaper prices are costing us all, right?
Yeah.
In every form.
Can I add a little bit to that? There's been efforts to preempt local legislation. We've been making advances at the city level, at the state level, and there's been efforts to preempt paid sick days, family leave, minimum wage legislation, and pull back those advances. And so I think one of the things we need to look at is how that affects the competitive advantage of local businesses as well. That have to, in some cases, for example, there are things such as safe harbor initiatives for businesses that would allow them, for example, to opt out of a local paid sick days bill in favor of some lower national standard. But the local businesses would still have to abide by the higher local standard, which I think it would be better for the community and health, et cetera, but then they're at a competitive disadvantage, and what does that mean?
Well, we're just hit time. I'm tempted to take a few more questions, but I bet we're going to get kicked off. So I think we'll just say thank you. We'll all be around and available and happy to chat more. Thanks.